Question 1. A behavior technician is recording the number of times a client says please during a therapy session. Which type of measurement is the technician using? A. Duration recording. B. Frequency recording. C. Latency recording. D. Whole interval recording. Answer: B. Frequency recording. This question tests your understanding of basic measurement procedures in ABA. Frequency recording involves counting how many times a specific behavior occurs during observation period, and the keyword number of times directly indicates counting. It's a simple way to track behaviors that have a clear beginning and end, like saying a word or hitting an object. If you want to know how often something happens, frequency is your go-to measure. Remember, frequency is just counting occurrences. Question 2. Which of the following is an example of positive reinforcement? A. A child is sent to timeout for hitting their sibling, and they stop hitting. B. A parent gives a child a sticker for completing their homework, and the child completes homework more often. C. A therapist removes a difficult task demand when a client starts crying, and the crying behavior decreases. D. An alarm goes off until you buckle your seatbelt, and you buckle up more often to avoid the sound. Answer: B. A parent gives a child a sticker for completing their homework, and the child completes homework more often. This question asks about positive reinforcement, which is a core principle of ABA. Positive reinforcement involves adding something desirable after a behavior occurs, which makes that behavior more likely to happen again in the future. In this example, the sticker is added after homework is done, and the result is an increase in homework completion. This is different from punishment, decreasing behavior, or negative reinforcement, removing something unpleasant to increase behavior. Think of positive reinforcement as adding something good to make a behavior happen more often. Question 3. In establishing operation, EO. A. Decreases the value of a reinforcer and decreases the likelihood of behavior that has been previously reinforced by that reinforcer. B. Increases the value of a reinforcer and increases the likelihood of behavior that has been previously reinforced by that reinforcer. C. Decreases the value of a reinforcer and increases the likelihood of behavior that has been previously reinforced by that reinforcer. D. Increases the value of a reinforcer and decreases the likelihood of behavior that has been previously reinforced by that reinforcer. Answer: B. Increases the value of a reinforcer and increases the likelihood of behavior that has been previously reinforced by that reinforcer. This question tests your knowledge of motivating operations, specifically establishing operations, EOs. An EO makes a reinforcer more valuable at that moment and makes behaviors that lead to that reinforcer more likely. For instance, being really thirsty, an EO, makes water, the reinforcer, much more valuable and makes you more likely to seek out water. It establishes the effectiveness of something as a reinforcer and increases the relevant behavior. Remember, EOs make things more valuable and relevant behaviors more likely. Question 4. A behavior analyst is conducting a functional assessment to determine why a client engages in hitting behavior. The analyst observes that hitting often occurs when the client is asked to do a difficult task, and it results in the task being removed. What function is the hitting behavior likely serving? A. Attention. B. Tangible. C. Escape. D. Automatic. Answer: C. Escape. This question is about the functions of behavior, which explain why a behavior happens. The scenario describes the hitting occurring when a difficult task is presented, and the result is the removal of that task. When a behavior is maintained because it allows the individual to get out of or avoid something unpleasant, the function is escape. This is a common function for behaviors like crying, tantrums, or aggression when demands are placed. If the behavior helps the person get away from something they don't like, it's probably escape. Question 5. Stimulus control occurs when A. A behavior is equally likely to occur in the presence of any stimulus. B. A behavior occurs more often in the presence of a specific stimulus than in its absence. C. A behavior only occurs when a reinforcer is immediately delivered. D. A behavior stops occurring because reinforcement is no longer provided. Answer: B. A behavior occurs more often in the presence of a specific stimulus than in its absence. This question defines stimulus control, a fundamental concept in ABA related to discrimination. Stimulus control happens when a behavior is more likely to occur when a specific stimulus, called a discriminative stimulus, or SD, is present than when it's absent. For example, a child learns that saying cookie only gets them a cookie when their parent is present, not when a stranger is there. The parent's presence becomes an SD for saying cookie. It means the behavior is controlled by certain stimuli in the environment. Question 6. What is the primary purpose of a skills assessment in ABA? A. To determine the function of challenging behaviors. B. To identify a client's current strengths and areas for growth. C. To select appropriate reinforcers for the client. D. To measure the duration of a specific behavior. Answer: B. To identify a client's current strengths and areas for growth. This question focuses on the purpose of skills assessments, which are a key part of the assessment phase in ABA. A skills assessment, like the VBMAPP or ABLSR, evaluates what a client can and cannot do across various domains, such as language, social skills, and daily living. This helps the behavior analyst figure out what skills need to be taught and where to start intervention. It's about understanding the client's current abilities, not why problem behaviors happen or finding reinforcers. Think of it as taking a snapshot of the client's current skills. Question 7. Which schedule of reinforcement is typically used to maintain a behavior that has already been learned? A. Continuous reinforcement, CRF. B. Fixed ratio, FR. C. Variable ratio, VR. D. Variable interval, VI. Answer: C. Variable ratio, VR. This question tests your understanding of reinforcement schedules and their common uses. While all intermittent schedules, FR, VR, FI, VI, are used for maintenance, variable ratio schedules typically produce high, steady rates of behavior that are resistant to extinction, making them ideal for maintaining learned skills. Continuous reinforcement is mainly for initial skill acquisition, and while other intermittent schedules work, VR is often favored for strong maintenance and high response rates. Think of slot machines. They are on a VR schedule, and people play them persistently because reinforcement is unpredictable but frequent on average. Question 8. A behavior plan states that a client earns a token for every 5 correct responses. This is an example of what type of reinforcement schedule? A. Fixed ratio, FR. B. Fixed interval, FI. C. Variable ratio, VR. D. Variable interval, VI. Answer: A. Fixed ratio, FR. This question asks you to identify a specific reinforcement schedule based on its description. A fixed ratio schedule delivers reinforcement after a set, predictable number of responses. The phrase "for every 5 correct responses" indicates that the number of responses, 5, is fixed. Ratio schedules are based on the number of responses, while interval schedules are based on time. Remember, ratio means number, and fixed means it's always the same number. Question 9. A behavior technician is asked to record data on the duration of a client's tantrum behavior. Which of the following is the best way to measure duration? A. Count the number of times the tantrum occurs. D. Record how long the tantrum lasts from beginning to end. C. Note whether the tantrum occurs at all during a specific interval. D. Record the time between the end of one tantrum and the start of the next. Answer: B. record how long the tantrum lasts from beginning to end. This question focuses on the measurement dimension of duration. Duration measurement involves recording the total amount of time that a behavior occurs from its onset, start, to its offset, end. The phrase duration of a client's tantrum behavior specifically asks for how long the tantrum lasts. Counting is frequency. Noting occurrence in an interval is interval recording, and time between behaviors is interresponse time. IRT. Duration is simply how long the behavior takes place. Question 10. Generalization of a skill occurs when A. The skill is taught using multiple examples. B. The skill is performed only in the specific environment where it was taught. C. The skill occurs in new environments or with new people or materials, without explicit training for those specific situations. D. The skill decreases in frequency over time. Answer. C. The skill occurs in new environments or with new people or materials, without explicit training for those specific situations. This question defines generalization, a crucial outcome in ABA that ensures skills are useful outside the therapy setting. Generalization means that a learned behavior or skill occurs in different settings, with different people, or with different materials than those used during training. It shows the behavior is not tied only to the training conditions. Teaching with multiple examples can help promote generalization, but the core definition is the behavior occurring in untrained contexts. Think of a child learning to say ball and then being able to label different balls, basketball, soccer ball, or say ball at the park, not just at the therapy table. Question 11. In a multiple baseline design, the intervention is implemented. A. Simultaneously across all baselines. B. Sequentially across different behaviors, settings, or subjects. C. Only after the target behavior has decreased significantly. D. By rapidly alternating between baseline and intervention conditions. Answer. B. Sequentially across different behaviors, settings, or subjects. This question describes the core feature of a multiple baseline experimental design, which is commonly used in ABA. In this design, data is collected on multiple baselines, example, the same behavior in different settings, or different behaviors of the same person, or the same behavior of different people, simultaneously. The intervention is then introduced to one baseline at a time, while the others remain in baseline. This staggered introduction allows the researcher to see if the behavior changes only when the intervention is applied to that specific baseline, demonstrating experimental control. The keyword is sequentially or staggered. Question 12. What is the primary ethical concern when using punishment procedures? A. Ensuring they are implemented by a qualified professional. B. Using the least restrictive intervention first. C. Collecting sufficient baseline data. D. Obtaining informed consent from the client. Answer. B. Using the least restrictive intervention first. This question addresses an important ethical guideline regarding the use of punishment. The ethical code and best practice in ABA require behavior analysts to recommend and implement the least restrictive effective procedures first. This means trying reinforcement-based strategies before resorting to punishment, which is considered more restrictive or intrusive. While the other options are also important ethical considerations, using the least restrictive alternative is a primary principle, specifically when considering punishment. Always start with teaching and reinforcement before considering punishment. Question 13. A discriminative stimulus, SD, is a stimulus that A. Signals that a behavior will be punished if it occurs. B. Signals that reinforcement is available if a specific behavior occurs. C. Is paired with a previously neutral stimulus to evoke a conditioned response. D. Increases the value of a reinforcer. Answer. B. Signals that reinforcement is available if a specific behavior occurs. This question defines a discriminative stimulus, SD, which is a key concept in understanding stimulus control. An SD is an environmental cue that signals that a specific behavior is likely to be reinforced if it occurs in its presence. For example, a red light, SD, signals that pressing the gas pedal behavior will not be reinforced. You might get a ticket, while a green light, SD, signals that pressing the gas pedal will be reinforced. You can proceed. It tells you when a particular behavior will pay off. Question 14. Which of the following is an example of negative reinforcement? A. Giving a child a cookie for cleaning their room, leading to more frequent room cleaning. B. Removing a chore requirement because a child completed their homework, leading to more frequent homework completion. C. Turning off a loud alarm by pressing a button, leading to more frequent button pressing. D. Taking away a toy because a child hit their sibling, leading to less frequent hitting. Answer: C. Turning off a loud alarm by pressing a button, leading to more frequent button pressing. This question asks you to identify an example of negative reinforcement. Negative reinforcement involves removing an unpleasant stimulus after a behavior occurs, resulting in an increase in the frequency of that behavior. In this case, the loud alarm, unpleasant stimulus, is removed by pressing the button behavior, which makes you more likely to press the button in the future to avoid the sound. The key is removing something bad to make a behavior happen more often. Option B is also negative reinforcement. Removing a chore increases homework, but C is a classic, clear example. Question 15. What is the primary difference between punishment and extinction? A. Punishment increases behavior, while extinction decreases behavior. B. Punishment involves adding or removing a stimulus to decrease behavior, while extinction involves withholding reinforcement for a previously reinforced behavior to decrease it. C. Punishment only works for attention-maintained behaviors, while extinction works for all functions. D. Punishment is always unethical, while extinction is always ethical. Answer: B. Punishment involves adding or removing a stimulus to decrease behavior, while extinction involves withholding reinforcement for a previously reinforced behavior to decrease it. This question highlights the core procedural difference between punishment and extinction, both of which aim to decrease behavior. Punishment works by adding an aversive stimulus or removing a reinforcing stimulus contingent on the behavior, making the behavior less likely in the future. Extinction, however, works by stopping the delivery of reinforcement for a behavior that was previously reinforced, so the behavior is no longer effective in getting what it needs and eventually decreases. The key distinction is the procedure. Adding/removing for punishment vs. withholding reinforcement for extinction. Question 1.6. The gradual removal of prompts is called A. Fading, B. Shaping, C. Chaining, D. Prompting. Answer: A. Fading. This question asks for the term describing the process of slowly reducing assistance to a learner. Fading is the procedure used to gradually lessen the level of prompting as the learner becomes more independent in performing a skill. It's like slowly removing support wheels from a bike as the rider learns to balance. Shaping involves reinforcing successive approximations of a behavior, chaining breaks a skill into steps, and prompting is giving assistance, but fading is about reducing that assistance over time. Question 17. When conducting a preference assessment, presenting two items at a time and recording which item the client chooses is called A. Multiple stimulus without replacement, MSWO, assessment. B. Paired stimulus, forced choice, assessment. C. Free operant observation. D. Multiple stimulus with replacement, MSW, assessment. Answer: B. Paired stimulus, forced choice, assessment. This question describes a specific method of conducting a preference assessment. The paired stimulus assessment, also known as forced choice, involves presenting items two at a time and recording which one the client selects. This method allows you to create a hierarchy of preferences by seeing which items are chosen over others. MSWO and MSW involve presenting multiple items in an array, while free operant involves observing what the client interacts with when given free access. The key is presenting items two at a time. Question 18. Data collected on the time between the delivery of a stimulus example, touch nose, and the initiation of the client's response is called A. Duration, B. Interresponse time, IRT, C. Latency, D. Frequency. Answer C. Latency. This question defines latency, which is a specific dimension of behavior measurement. Latency is the time elapsed from the presentation of a stimulus, like an instruction or cue, to the beginning of the response. It measures how long it takes the person to start doing the behavior after being prompted or given an opportunity. Duration measures how long the behavior lasts, IRT measures time between responses, and frequency measures the count. Latency is about the get-go time after a cue. Question 19. Reinforcing successive approximations toward a target behavior is the definition of A. Prompting, B. Fading, C. Chaining, D. Shaping. Answer D. Shaping. This question defines shaping, a procedure used to teach new behaviors by reinforcing steps that are closer and closer to the desired final behavior. You start by reinforcing anything that resembles the target behavior, then only reinforce responses that are a bit closer, and so on, until the client performs the target behavior. It's like molding clay. You gradually refine the behavior. Prompting gives help, fading removes help, and chaining links behaviors together, but shaping builds a new behavior step by step. Question 20. A behavior intervention plan, BAP, should be based on A. A hypothesis about the cause of the behavior, B. Input from the client's family and teachers, C. The result of a functional behavior assessment, FBA, D. The most recent research on the behavior. Answer C. The results of a functional behavior assessment, FBA. This question emphasizes the foundation upon which an effective behavior intervention plan should be built. A behavior intervention plan, BAP, is designed to address challenging behaviors, and its strategies should directly target the function of the behavior as identified through a functional behavior assessment, FBA. An FBA systematically gathers information to determine why the behavior is happening, and the BIP uses that information to develop strategies that make the problem behavior inefficient, ineffective, and irrelevant, while teaching replacement behaviors. The FBA findings are the critical evidence needed to create a meaningful BIP. Question 21. What ethical principle relates to the responsibility to operate within one's scope of competence? A. Beneficence, B. Fidelity, C. Integrity, D. Professional and scientific relationships. Answer D. Professional and scientific relationships. This question asks about an ethical principle from the BACB's Professional and Ethical Compliance Code. The principle of professional and scientific relationships includes the requirement for behavior analysts to provide services only within their areas of competence, which means having the necessary education, training, and supervised experience. Beneficence relates to doing good, fidelity to trustworthiness, and integrity to honesty. Maintaining competence ensures you are qualified to provide the services you offer. Question 22. A functional analysis involves A. Directly observing behavior in the natural environment, B. Systematically manipulating antecedents and consequences to determine their effect on the target behavior, C. Interviewing caregivers about the circumstances surrounding the behavior, D. Reviewing historical records of the client. Answer B. Systematically manipulating antecedents and consequences to determine their effect on the target behavior. This question defines a functional analysis, FA, which is a type of functional behavior assessment that is considered the most direct and precise. In an FA, the behavior analyst deliberately arranges specific conditions, like presenting attention, removing demands, or providing tangibles, to see how the target behavior occurs in each condition. This systematic manipulation helps confirm the function of the behavior by showing what consequences maintain it. It's an experimental approach to figuring out why a behavior is happening. Question 23. Which verbal operant is controlled by a nonverbal stimulus and is reinforced by generalized conditioned reinforcement? A. Mand. B. Tact. C. Echoic. D. Intraverbal. Answer B. Tact. This question is about verbal behavior, specifically identifying the definition of a tact. A tact is a verbal response that names or labels something in the environment. A nonverbal stimulus, like seeing a dog, the response is reinforced by generalized conditioned reinforcement, such as praise. That's right, that's a dog, or attention. A mand is a request controlled by an MO, an echoic is repeating something heard, and an intraverbal is a response to another's verbal behavior, like answering a question. A tact is essentially labeling something you see, hear, smell, taste, or touch. Question 24. In a discrete trial training, DTT, session, the therapist presents a stimulus, waits for the client's response, provides a consequence, and records the data. What is the first step the therapist typically does before presenting the stimulus? A. Deliver reinforcement. B. Establish instructional control. C. Gain the client's attention. D. Provide a prompt. Answer C. Gain the client's attention. This question describes the typical flow of a discrete trial and asks about the crucial initial step. Before delivering an instruction or presenting a stimulus in DTT, it is essential to ensure the learner is attending. Gaining attention maximizes the likelihood that the learner hears the instruction or sees the stimulus, making the trial effective. While instructional control is important overall, and prompts and reinforcement come later in the trial, getting the learner's focus is the immediate first action in setting up a discrete trial. Make sure they're looking and listening before you start. Question 25. What is Inter-Observer Agreement, IOA? A. The degree to which two or more independent observers report the same observed values after measuring the same events. B. A measure of how consistently a single observer records a behavior over time. C. The percentage of trials in which a client responds correctly. D. The agreement between a behavior analyst report and a parent's report of behavior frequency. Answer A. The degree to which two or more independent observers report the same observed values after measuring the same events. This question defines Inter-Observer Agreement, IOA, which is a crucial measure of the quality and trustworthiness of behavioral data. IOA is calculated by having two or more people independently observe and record the same behavior at the same time, and then comparing their data to see how closely they match. High IOA indicates that the definition of the behavior is clear, and the observers are recording it reliably. It's basically checking if everyone is seeing the same thing and counting it the same way. Question 26. An intervention that involves teaching a replacement behavior that serves the same function as the challenging behavior is called. A. Stimulus control. B. Differential reinforcement of alternative behavior, DRA. C. Response cost. D. Timeout. Answer B. Differential reinforcement of alternative behavior, DRA. This question describes differential reinforcement of alternative behavior, DRA, which is a common and effective intervention strategy. DRA involves reinforcing a specific behavior that is an alternative to the challenging behavior, while withholding reinforcement for the challenging behavior itself, extinction. The replacement behavior should ideally serve the same function, making it more likely to occur instead of the problem behavior. It's about teaching and rewarding a better way to get the same outcome. Question 27. A behavior technician notices a client engaging in a behavior that is not targeted in the current plan. The technician should first A. Immediately implement a punishment procedure. B. Ignore the behavior completely. C. Consult with their supervisor about the behavior. D. Try to figure out the function of the behavior on their own. Answer: C. Consult with their supervisor about the behavior. This question addresses the appropriate action for a behavior technician when faced with a new challenging behavior. Behavior technicians work under the supervision of a BCBA or BCABA. If a behavior arises that is not in the current treatment plan, the technician's responsibility is to collect objective data, if possible, and most importantly, communicate with and seek guidance from their supervisor. Technicians should not unilaterally implement new interventions or try to determine function alone. That is the supervisor's role. When in doubt about something new or unexpected, always check with your supervisor. Question 28. What is the purpose of a baseline phase in an ABA graph? A. To show the effect of the intervention. B. To demonstrate a return to original behavior levels. C. To collect data on the target behavior before the intervention is introduced. D. To compare the effectiveness of two different interventions. Answer: C. To collect data on the target behavior before the intervention is introduced. This question asks about the role of the baseline phase in research designs and graphs used in ABA. The baseline condition, often labeled A in designs like AB or ABAB, is a period where data is collected on the target behavior before any planned intervention is implemented. This provides a standard or comparison point to see what the behavior looks like under typical conditions before the intervention is introduced. It helps determine if the intervention actually caused a change. Baseline shows the behavior without the intervention. Question 29. A conditioned reinforcer is a stimulus that A. Is naturally reinforcing, example, food, water. B. Acquires reinforcing properties through pairing with an unconditioned or other conditioned reinforcer. C. Signals that punishment is available. D. Decreases the frequency of a behavior. Answer: B. Acquires reinforcing properties through pairing with an unconditioned or other conditioned reinforcer. This question defines a conditioned reinforcer, which is a type of reinforcer learned through association. Unlike unconditioned reinforcers, like food or water, which are reinforcing naturally, a conditioned reinforcer, like praise, tokens, or money, becomes reinforcing because it has been repeatedly paired with other reinforcers. For example, if you always say, "good job," neutral stimulus, right before giving a child a preferred toy, unconditioned reinforcer, "good job," can become a conditioned reinforcer. It's a learned reward. Question 30. Which type of discontinuous measurement involves recording whether a behavior occurred at any point during an interval? A. Partial interval recording. B. Whole interval recording. C. Momentary time sampling. D. Frequency recording. Answer: A. Partial interval recording. This question describes partial interval recording, a type of discontinuous measurement where the observation period is divided into intervals. In partial interval recording, you mark down if the target behavior occurred at any point during that interval, even if it was very brief. This method often overestimates the duration and underestimates the frequency of behavior, but is useful for behaviors that don't have clear start or end points or occur at high rates. If the behavior happens at all within the interval, you mark it. Question 31. What is the primary ethical responsibility regarding client confidentiality? A. Discussing client information with other professionals for consultation purposes. B. Sharing client progress updates with family members who are not involved in treatment. C. Protecting client information and only disclosing it with proper consent or legal requirement. D. Using client names and details in public presentations for educational purposes. Answer: C. protecting client information and only disclosing it with proper consent or legal requirement. This question addresses the critical ethical principle of confidentiality. Behavior analysts and technicians are ethically bound to protect clients' private information and only share it under specific, approved circumstances, such as having written consent from the client or legal guardian, or when legally required, key mandated reporting of abuse. Discussing details with unauthorized persons or using identifiable information publicly is a breach of confidentiality. Confidentiality means keeping client information private and secure. Question 32. An echoic is a verbal operant that is A. A response to another person's verbal behavior. B. Naming or labeling something. C. Repeating something that was heard. D. A request for something. Answer. C. Repeating something that was heard. This question defines the verbal operant known as an echoic. An echoic response is controlled by a verbal stimulus. Someone says something, and the response is the same as the stimulus. The person repeats what was said. This is typically reinforced by generalized conditioned reinforcement like praise, could saying. It's like an echo. You hear words and say the same words back. This is a foundational skill in early language development. Question 33. Which of the following is an example of automatic reinforcement? A. A child screams until they get a toy. B. A person scratches an itch and the itching stops. C. A student completes homework to earn praise from the teacher. D. A child rocks back and forth because it feels good. Answer. D. A child rocks back and forth because it feels good. This question asks you to identify automatic reinforcement, which is reinforcement that occurs without the direct involvement of another person. Automatic reinforcement happens when the behavior itself produces a consequence that is reinforcing. This can be sensory, like rocking because it feels good or makes a visual stimulus, or related to escape from internal discomfort, like scratching an itch, unlike social functions, attention, tangible, escape from external demands. Automatic reinforcement is internally maintained. If the behavior produces its own reinforcement, it's automatic. Question 34. When a previously reinforced behavior no longer results in reinforcement and its frequency decreases over time, this is called A. Punishment. B. Extinction. C. Response cost. D. Timeout. Answer. B. Extinction. This question describes the process of extinction, a procedure used to decrease behavior. Extinction occurs when the reinforcement that was maintaining a behavior is consistently withheld following the behavior, leading to a decrease in the behavior's future frequency. For example, if a child's crying used to get parental attention, reinforcement, and the parent stopped providing attention when the child cries, the crying behavior may decrease through extinction. It's important to identify the specific reinforcer maintaining the behavior to effectively implement extinction. No more payoff means less behavior. Question 35. A graph that shows the cumulative number of responses over time is called A. Line graph. B. Bar graph. C. Cumulative record. D. Scatter plot. Answer. C. Cumulative record. This question describes a cumulative record, which is a specific type of graph used in ABA. A cumulative record displays the total number of responses recorded since the beginning of data collection, with each response causing the line to go up. The steeper the slope of the line, the higher the rate of behavior. Unlike a standard line graph that might show rate per session, a cumulative record never goes down, only up or stays flat, showing the ongoing accumulation of responses. It's a unique way to visualize total responses over time and rate changes. Question 36. What does a motivating operation, MO, do? A. It signals the availability of reinforcement. B. It increases or decreases the effectiveness of a reinforcer and affects the frequency of behavior that has been reinforced by that reinforcer. C. It is a consequence that follows a behavior. G. It is a neutral stimulus that is paired with an unconditioned stimulus. Answer B. It increases or decreases the effectiveness of a reinforcer and affects the frequency of behavior that has been reinforced by that reinforcer. This question defines a motivating operation, MO, which is a crucial concept in understanding why someone might engage in a particular behavior at a particular time. An MO changes the value of a reinforcer, making it more or less desirable, and also affects the likelihood of behaviors that have produced that reinforcer in the past. For example, being hungry, MO, makes food, reinforcer, more valuable and increases behaviors like going to the kitchen. Most change what you want and make you more likely to work for it. Question 37. Pairing a neutral stimulus with an unconditioned stimulus so that the neutral stimulus eventually elicits a conditioned response is the process of A. Operant conditioning. B. Classical conditioning. C. Shaping. D. Prompting. Answer B. Classical conditioning. This question describes the process of classical conditioning, also known as Pavlovian conditioning. In classical conditioning, a previously neutral stimulus is paired repeatedly with an unconditioned stimulus that naturally elicits a response, an unconditioned response. Through this pairing, the neutral stimulus becomes a conditioned stimulus and gains the ability to elicit a similar response, a conditioned response, even without the unconditioned stimulus being present. Think of Pavlov's dogs, where the bell, neutral, then conditioned stimulus, paired with food, unconditioned stimulus, eventually caused salivation, unconditioned, then conditioned response. It's about learning associations between stimuli. Question 38. A supervision contract should include A. The supervisor's personal opinions about the supervisee. B. Details about the frequency, format, and expectations of supervision. C. A list of all clients the supervisee is working with. D. The supervisee's financial information. Answer B. Details about the frequency, format, and expectations of supervision. This question relates to the ethical requirements for supervision in ABA. A supervision contract is a formal agreement between a supervisor and supervisee that outlines the structure and expectations of the supervisory relationship. It must include practical details such as how often they will meet, the format of supervision, in person, remote, the responsibilities of both parties, and performance expectations. This ensures clarity and a professional working relationship. A clear contract sets the stage for effective supervision. Question 39. Which type of reinforcement is delivered after a variable number of responses? A. Fixed interval, FI. B. Fixed ratio, FR. C. Variable interval, VI. D. Variable ratio, VR. Answer D. Variable ratio, VR. This question asks about a specific schedule of reinforcement based on the number of responses. A variable ratio schedule delivers reinforcement after a number of responses that varies around an average. For example, a VR10 means reinforcement is delivered after an average of 10 responses, but it might be 8 responses one time, 12 the next, 9 after that, and so on. The key is that the number of responses required changes from one reinforcement to the next. Ratio is about responses, and variable means it changes. Question 40. What is the primary focus of ethical considerations in ABA practice? A. Maximizing revenue for the practice. B. Ensuring the comfort of the therapist. C. Protecting the rights and welfare of the client. D. Meeting productivity quotas. Answer C. Protecting the rights and welfare of the client. This question addresses the overarching goal of ethical guidelines in the field of behavior analysis. The primary purpose of the ethical code and professional conduct standards is to ensure that behavior analysts and technicians prioritize the safety, dignity, autonomy, and overall well-being of the individuals they serve. All ethical decisions should ultimately consider what is in the best interest of the client. Putting the client first is the cornerstone of ethical practice. Question 41. A procedure where reinforcement is delivered for responses that are incompatible with the target behavior is called A. Differential reinforcement of other behavior. DDRO. B. Differential reinforcement of alternative behavior. DRA. C. Differential reinforcement of incompatible behavior. DRI. D. Response cost. Answer C. Differential reinforcement of incompatible behavior. DRI. This question defines differential reinforcement of incompatible behavior. DRI. A specific type of differential reinforcement. DRI involves reinforcing a behavior that cannot happen at the same time as the challenging behavior. For instance, if a child engages in thumb sucking, reinforcing them for having their hands in their pockets is DRI because you can't suck your thumb with your hands in your pockets. This is a type of DRI where the alternative behavior is specifically incompatible. Reinforcing a behavior that physically prevents the problem behavior is DRI. Question 42. If a behavior occurs at a high rate and is maintained by attention, which extinction procedure would be appropriate? A. Withholding the preferred tangible item. B. Ignoring the behavior. C. Presenting a difficult task demand. D. Providing the client with sensory stimulation. Answer B. Ignoring the behavior. This question asks about implementing extinction for a behavior maintained by attention. If the function of a behavior is attention, the corresponding extinction procedure is to withhold that attention when the behavior occurs. This is often referred to as planned ignoring. Other extinction procedures address different functions. Withholding tangibles for tangible function, continuing demands for escape function, and blocking sensory input or redirecting for automatic function. To extinguish attention-seeking behavior, stop giving it attention. Question 4.3. What is the definition of a prompt? A. A consequence delivered after a behavior. B. An antecedent stimulus that is added or adjusted to increase the likelihood of a correct response. C. A procedure to decrease the frequency of a behavior. D. Reinforcement delivered on a fixed schedule. Answer B. An antecedent stimulus that is added or adjusted to increase the likelihood of a correct response. This question defines a prompt, which is a type of antecedent strategy used to help a learner perform a skill correctly. A prompt is any form of assistance given before or during the performance of a behavior to increase the chance that the learner will respond correctly. Examples include physical guidance, verbal instructions, visual cues, or modeling. Prompts are temporary supports used to help the learner get it right, so they can access reinforcement, and they should be faded over time. A prompt is a hint or help provided before the response. Question 44. What is the purpose of graphing data in ABA? A. To impress parents and colleagues. B. To comply with administrative requirements. C. To visually display the relationship between behavior and environmental variables over time. D. To calculate summary statistics for a report. Answer C. To visually display the relationship between behavior and environmental variables over time. This question focuses on the primary function of graphing data in ABA. Graphs provide a clear visual representation of how a client's behavior is changing over time and how it is being affected by the interventions being implemented. This visual analysis is critical for making database decisions about whether the intervention is working or needs to be adjusted. Graphs help us see trends and patterns that numbers alone might miss. Data visualization helps us understand what's happening with the behavior. Question 45. An intraverbal is a verbal operant where A. A person repeats what someone else says. B. A person requests something they want. C. A person labels something in the environment. D. A person responds to another person's verbal behavior, where the response has no point-to-point correspondence with the stimulus. Answer: D. A person responds to another person's verbal behavior, where the response has no point-to-point correspondence with the stimulus. This question defines an intraverbal, which is a crucial part of conversational skills. An intraverbal occurs when someone responds to another person's verbal behavior, like answering a question, filling in the blank, or continuing a conversation. And the response doesn't match the stimulus word for word. For example, if you say, "Ready, set," and the client says, "Go," that's an intraverbal. It's controlled by verbal stimuli, and the response is different from the stimulus. Intraverbals are like pieces of a conversation. Question 46. A task analysis is the process of A. Determining the function of a behavior. B. Breaking down a complex skill into smaller, manageable steps. C. Identifying potential reinforcers for a client. D. Collecting data on the duration of a behavior. Answer: B. Breaking down a complex skill into smaller, manageable steps. This question defines a task analysis, a common procedure used in ABA to teach complex skills. A task analysis involves taking a skill that has multiple steps, like washing hands or getting dressed, and breaking it down into a sequence of smaller, simpler steps that can be taught individually. This makes the skill more achievable for the learner. Each step becomes a link in a chain of behaviors. Think of it like writing down every single tiny action needed to complete a task. Question 47. Which ethical guideline requires behavior analysts to collect data to monitor client progress? A. Responsible conduct of behavior analysts. B. Responsibility to clients. C. Integrity. D. Confidentiality. Answer: B. Responsibility to clients. This question relates to the ethical responsibility of behavior analysts regarding their clients' treatment. The ethical code under responsibility to clients emphasizes the importance of designing effective programs and continuously monitoring client progress using data. This ensures that interventions are based on evidence and are working for the individual client. Data collection is not just a procedural step. It's an ethical requirement to ensure effective treatment. You have an ethical duty to use data to guide your work with clients. Question 48. An antecedent is A. A consequence that follows a behavior. B. Something that happens before a behavior. C. A measure of behavior frequency. D. A preferred item used as a reinforcer. Answer: B. Something that happens before a behavior. This question asks for the definition of an antecedent, a fundamental concept in the three-term contingency. ABC. An antecedent is an environmental stimulus or event that occurs immediately before a behavior. It can be a cue, a person, a place, or a specific time. Understanding antecedents helps us predict when a behavior is likely to occur and can be manipulated to prevent challenging behavior or set the occasion for desired behavior. It's the A in ABC, what happens right before the behavior. Question 49. A behavior technician is recording data during a 10-minute observation. They divide the time into 30-second intervals and mark if the behavior occurs at the very end of each interval. This is an example of what type of measurement? A. Partial interval recording. B. Whole interval recording. C. Momentary time sampling. D. Duration recording. Answer: C. Momentary time sampling. This question describes momentary time sampling, a discontinuous measurement method. In momentary time sampling, the observer records whether the behavior is occurring exactly at the specific moment the interval ends. This differs from partial, any time in the interval, and whole, throughout the entire interval. It's like taking snapshots of behavior at predefined points in time. Momentary is the key word here, indicating the behavior is recorded only if it happens at the specific point in time the interval stops. Question 50. When teaching a new skill using backward chaining, the therapist A. Teaches the first step of the task analysis first. B. Teaches the last step of the task analysis first. C. Teaches all steps of the task analysis simultaneously. D. Reinforces every response the client makes. Answer: B. Teaches the last step of the task analysis first. This question describes backward chaining, a method for teaching skills broken down by a task analysis. In backward chaining, the therapist completes all steps of the task analysis except the very last one. The client is prompted to complete the last step and is immediately reinforced. Once the client can independently do the last step, the therapist completes all but the last two steps, and the client is taught to do the second to last step, followed by the last one. Teaching proceeds backward from the final step. The reinforcement for completing the final step is always available. Question 51. A behavior technician is implementing a procedure where the client earns tokens for completing tasks, which can later be exchanged for preferred items. This is an example of A. Continuous reinforcement schedule. B. Response cost system. C. Token economy. D. Negative punishment procedure. Answer: C. Token economy. This question describes a token economy, a system widely used in ABA. A token economy involves providing a client with generalized conditioned reinforcers, tokens, points, stickers, immediately after they perform a target behavior. These tokens have little value themselves, but can be exchanged later for backup reinforcers, preferred items, or activities. This bridges the time gap between behavior and a more substantial reinforcer, and allows for the reinforcement of multiple behaviors with the same token. Earning small symbolic rewards that can be traded for bigger rewards is a token economy. Question 52. Which ethical consideration involves being truthful and honest in your work? A. Integrity. B. Beneficence. C. Justice. D. Fidelity. Answer: A. Integrity. This question asks about the ethical principle of integrity. The ethical principle of integrity requires behavior analysts and technicians to be truthful, honest, and promote accuracy in their practice, research, and teaching. This includes avoiding deceptive statements, correcting misrepresentations, and not engaging in fraudulent behavior. Acting with integrity means being honest and trustworthy in all professional dealings. Question 53. A variable interval, VI. Schedule of reinforcement delivers reinforcement after A. A fixed amount of time. B. A variable amount of time. C. A fixed number of responses. D. A variable number of responses. Answer: B. A variable amount of time. This question describes a variable interval, VI, schedule of reinforcement. In a VI schedule, reinforcement becomes available after a period of time has passed, and the length of that time period varies around an average. For example, a VI 5-minute schedule means reinforcement is available after an average of 5 minutes, but it might be 3 minutes one time, 7 minutes the next, etc., provided the target behavior occurs at least once after the interval has passed. The key is that the time changes and reinforcement is contingent on a response after the time is up. Variable interval means changing time between reinforcement opportunities. Question 54. What is the primary purpose of establishing rapport with a client? A. To make the client like the therapist. B. To gain the client's trust and cooperation. C. To ensure the client follows all instructions. D. To collect baseline data more easily. Answer: B. To gain the client's trust and cooperation. This question addresses the importance of building rapport in therapeutic relationships. Establishing rapport means developing a positive and trusting relationship with the client. This is crucial in ABA because a trusting relationship makes the client more comfortable, more likely to engage in therapy activities, and more receptive to learning and instruction. While liking the therapist is a part of it, The ultimate goal is a foundation of trust and cooperation that facilitates effective intervention. Building trust helps the client feel safe and motivated to work with you. Question 55. When a client's challenging behavior worsens briefly at the beginning of an extinction procedure, this is known as A. Spontaneous recovery, B. Punishment, C. An extinction burst, D. Stimulus generalization. Answer C. An extinction burst. This question describes an extinction burst, a common and expected phenomenon when implementing extinction. An extinction burst is a temporary increase in the frequency, intensity, or variability of a behavior when reinforcement is first withheld. It's like the client is trying harder to get the reinforcement that used to work. For example, if crying for attention is put on extinction, the crying might initially become louder or last longer before it starts to decrease. It's a sign that the extinction procedure is likely having effect. Question 56. What type of graph is most commonly used in ABA to display a single client's behavior over time? A. Bar graph, B. Scatter plot, C. Cumulative record, D. Line graph. Answer D. Line graph. This question asks about the most typical graph used in ABA for tracking individual progress. Line graphs are widely used because they effectively show changes in behavior over time by plotting data points chronologically and connecting them with lines. This allows for easy visual analysis of trends, increasing, decreasing, stable, and the effect of interventions across different phases. While other graphs are used for specific purposes, the line graph, specifically equal interval line graph, is the standard for tracking behavior change. Line graphs are ideal for seeing how behavior changes from day to day or session to session. Question 57. A man is a verbal operant that is controlled by A. A nonverbal stimulus, B. Another person's verbal behavior, C. A motivating operation, MO, D. A neutral stimulus paired with a reinforcer. Answer C. A motivating operation, MO. This question defines a mand, which is a type of verbal behavior that functions as a request or a demand. A mand is controlled by a motivating operation, MO, meaning the speaker is asking for something they want or need because that thing is currently reinforcing due to the MO. For example, being thirsty, MO, makes water valuable and prompts the mand water, please. Request for water, mands specify their own reinforcement. Mands are essentially asking for something you are motivated to get. Question 58. Which ethical principle requires behavior analysts to prioritize interventions that are scientifically supported and effective? A. Integrity, B. Responsible conduct of behavior analysts, C. Beneficence, D. Justice. Answer C. Beneficence. This question relates to the ethical principle of beneficence. Beneficence means doing good and ensuring that the services provided are in the client's best interest. This principle requires behavior analysts to use evidence-based practices, select interventions with the highest probability of success, and maximize benefits while minimizing harm to the client. Choosing effective, research-backed methods aligns directly with this principle. Your work should aim to do the most good for the client. Question 59. A schedule of reinforcement where the first response after a fixed amount of time has passed is reinforced is called A. Fixed ratio, FR, B. Variable ratio, VR, C. Fixed interval, FAVI, D. Variable interval, VI. Answer C. Fixed interval, FAVI. This question describes a fixed interval, FAVI, schedule of reinforcement. In an FI schedule, reinforcement becomes available for the first response that occurs after a set, predictable amount of time has passed. For example, on an FI 5-minute schedule, the client would be reinforced for the first target behavior they do after 5 minutes have elapsed since the last reinforcement. This schedule often produces a scalloped pattern of responding, with a pause after reinforcement followed by an increase in rate as the end of the interval approaches. Fixed interval means the time is set and unchanging. Question 60. What is the purpose of collecting IOA data? A. To ensure consistency in data collection by different observers. B. To measure the effectiveness of an intervention. C. To identify the function of a behavior. D. To determine the client's preference for reinforcers. Answer: A. To ensure consistency in data collection by different observers. This question asks about the practical reason for collecting inter-observer agreement, IOA. IOA is collected to check the reliability of the data being recorded. If multiple independent observers can agree on what the behavior is and how often or how long it's occurring, it indicates that the behavior definition is clear and the measurement system is reliable. High IOA increases confidence that the data accurately reflect the behavior and are not just influenced by who is collecting them. IOA helps ensure your data is accurate regardless of who is watching. Question 61. A contingency refers to A. A consequence that decreases behavior. B. The relationship between an antecedent, a behavior, and a consequence. C. A type of motivating operation. D. A procedure for teaching new skills. Answer: B. The relationship between an antecedent, a behavior, and a consequence. This question defines a contingency, a core concept in operant conditioning and ABA, often referred to as the three-term contingency or ABC. A contingency describes the dependent relationship between the antecedent, what happens before the behavior itself, and the consequence, what happens immediately after the behavior. Understanding these relationships is fundamental to analyzing and changing behavior, because consequences are contingent on the behavior occurring in the presence of specific antecedents. Contingency is the if, then relationship in behavior. Question 62. What is the primary reason for using individualized interventions in ABA? A. To make therapy more expensive. B. Because every client is unique and responds differently to interventions. C. To make data collection more complex. D. To comply with legal requirements. Answer: B. Because every client is unique and responds differently to interventions. This question emphasizes the importance of individualization in ABA treatment. Effective behavior analysis requires tailoring interventions to the specific needs, preferences, skills, and environmental circumstances of each individual client. What works for one person may not work for another, even if they have similar diagnosis or behaviors. Individualization ensures that the intervention is the most appropriate and effective for that specific person. ABA is not a one-size-fits-all approach. It's customized for each learner. Question 63. A child says car when they see a picture of a car. This is an example of A. Manned. B. Tact. C. Echoic. D. Introverbal. Answer: B. Tact. This question asks you to identify the verbal operant based on the description. The child's response car is controlled by seeing the picture of a car, a nonverbal stimulus. Saying the name of something you see is the definition of a tact. They are labeling or naming something in their environment. It's not a request. Manned, not repeating, echoic, and not a response to conversation, introverbal. Seeing something and naming it is a tact. Question 64. Differential reinforcement of other behavior. DRO involves reinforcing. A. A behavior that is incompatible with the target behavior. B. An alternative behavior that serves the same function as the target behavior. C. The absence of the target behavior for a specific period of time. D. The target behavior every time it occurs. Answer C. The absence of the target behavior for a specific period of time. This question defines differential reinforcement of other behavior. Duro. Another type of differential reinforcement. In Duro, reinforcement is delivered if the challenging behavior does not occur for a specified interval of time. The reinforcement is contingent on the absence of the problem behavior, regardless of what other behaviors occur, hence other behavior. This differs from DRI, reinforcing an incompatible behavior, or DRA. Reinforcing any alternative behavior. With DRO, you're reinforcing the lack of the problem behavior for a while. Question 65. What is the primary purpose of a crisis intervention plan? A. To punish challenging behavior quickly. B. To teach replacement behaviors. C. To ensure the safety of the client and others during dangerous behavior. D. To determine the function of a behavior. Answer C. To ensure the safety of the client and others during dangerous behavior. This question asks about the role of a crisis intervention plan, which is distinct from a standard behavior intervention plan. A crisis plan is specifically designed for behaviors that pose an immediate risk of harm to self or others. Its primary goal is to manage the dangerous situation safely and prevent injury, not to teach new skills or identify functions in the moment. These plans outline procedures to follow when a behavior escalates to a dangerous level. Safety is the top priority during a crisis. Question 66. When a learned behavior reappears after it has been decreased through extinction, this is called A. Extinction burst. B. Spontaneous recovery. C. Punishment. D. Generalization. Answer B. Spontaneous recovery. This question describes spontaneous recovery, another phenomenon associated with extinction. Spontaneous recovery is the temporary reappearance of a behavior that had previously been reduced or eliminated through extinction, even though it is not being reinforced. The behavior is usually short-lived and at a lower intensity than before extinction. It's like the behavior pops back up unexpectedly after seeming gone. It shows that the learning wasn't erased, just suppressed. Question 67. A behavior technician is recording whether a client remained in their seat for the entire 5-minute interval. If the client got out of their seat at any point, the technician did not record the behavior as occurring for that interval. This is an example of what type of measurement? A. Partial interval recording. B. Whole interval recording. C. Momentary time sampling. D. Frequency recording. Answer B. Whole interval recording. This question describes whole interval recording, a type of discontinuous measurement. In whole interval recording, the behavior is recorded as occurring only if it happens continuously throughout the entire interval. If the behavior stops at any point or doesn't start until partway through, it's not recorded for that interval. This method tends to underestimate the total duration or frequency of behaviors that don't last the whole interval. Whole means it has to last the entire interval. Question 68. What is the primary purpose of pairing yourself with reinforcement? A. To make the client dependent on you. B. To become a conditioned reinforcer for the client. C. To make the client follow instructions immediately. D. To reduce the need for primary reinforcers. Answer B. To become a conditioned reinforcer for the client. This question asks about the technique of pairing, which is crucial for establishing a positive therapeutic relationship and making the therapist a reinforcing presence. Pairing involves associating yourself, a neutral stimulus initially, with things the client already likes, unconditioned or existing conditioned reinforcers, such as preferred toys, activities, or praise delivered along with tangibles. Through repeated pairing, your presence and interactions become reinforcing to the client, making therapy more engaging and effective. Pairing yourself with good things makes working with you reinforcing. Question 69. A client is taught to say hello when greeting staff at the clinic. They then start saying hello to people they meet at the grocery store without being taught to do so there. This is an example of A. Stimulus generalization. B. Response for generalization. C. Discrimination. D. Extinction. Answer: A. Stimulus generalization. This question describes stimulus generalization, a type of generalization where a behavior that was reinforced in the presence of one stimulus occurs in the presence of other similar stimuli without specific training in those new contexts. The behavior, saying hello, is the same, but the stimulus person greeted has changed from the training environment, clinic staff, to a different environment, grocery store people. The behavior generalizes across different stimuli. Think of it as responding similarly to things that look or sound alike. Question 70. The ethical principle of minimizing risk of harm relates most directly to A. Selecting the most effective intervention, even if it carries some risk. B. Avoiding any procedures that the client or family might dislike. C. Implementing procedures that protect the client from potential injury or negative side effects. D. Always using positive reinforcement and never punishment. Answer: C. Implementing procedures that protect the client from potential injury or negative side effects. This question addresses the ethical principle of minimizing risk of harm, part of beneficence. This principle requires behavior analysts to take all necessary steps to protect the client from potential physical, psychological, or social harm during assessment and intervention. This includes carefully considering the potential risks and benefits of any procedure, having safety protocols in place, and using the least restrictive effective procedures. It's about proactively ensuring the client's safety and well-being. Your ethical duty includes protecting clients from potential harm. Question 71. A behavior technician is observing a client for 30 minutes and counts every instance of hand flapping. What type of measurement is this? A. Duration. B. Frequency. C. Latency. D. IRT. Answer: B. Frequency. This question asks to identify the measurement type used when counting occurrences of a behavior. Counting every instance of hand flapping over a specific period is frequency recording. This measures how many times the behavior happened. Duration would be how long each instance lasted. Latency would be time from a cue to flapping, and IRT would be time between flaps. Counting how many times something happens is frequency. Question 72. Which of the following is an example of response generalization? A. A child learns to say cookie and then says cracker when they want a snack. B. A child learns to say cookie when they see a picture of a cookie and also says cookie when they see a real cookie. C. A child learns to say cookie when they want a cookie and then says cookie when they want juice. D. A child learns to say cookie at home and then says cookie at grandma's house. Answer: A. A child learns to say cookie and then says cracker when they want a snack. This question describes response generalization, where a learner performs new or untrained responses that are functionally equivalent to the trained response. The stimulus, wanting a snack, is the same, but the response changes from the trained cookie to an untrained but related response, cracker, which also achieves the same outcome, getting a snack. Option B is stimulus generalization. Same response, different stimulus. Options C and don't fit the definition. Response generalization means varying the way you respond while achieving the same goal. Question 73. When a previously neutral stimulus is paired with an unconditioned punisher, the neutral stimulus may become A. Conditioned reinforcer. B. Discriminative stimulus. SD. C. Conditioned punisher. D. Motivating operation. MO. Answer: C. Conditioned punisher. This question describes the development of a conditioned punisher through classical conditioning, a neutral stimulus, something that doesn't initially affect behavior, that is consistently paired with an unconditioned punisher, something naturally aversive, like pain or a loud noise, can acquire punishing properties itself. For example, if the sound of a specific tone, neutral, is always followed by a shock, unconditioned punisher, the tone may eventually become a conditioned punisher, decreasing behaviors it follows. It's a learned punisher. Question 74. When providing feedback to a supervisee, a supervisor should A. Only focus on areas for improvement. B. Provide only positive feedback. C. Be specific, objective, and include both positive feedback and areas for growth. D. Compare the supervisee to other technicians. Answer. C. Be specific, objective, and include both positive feedback and areas for growth. This question relates to effective and ethical supervision practices. Providing effective feedback is crucial for a supervisee's development. Feedback should be specific, referencing particular instances, objective, based on observed behavior and data, and balanced, acknowledging strengths, positive feedback, as well as identifying areas that need improvement. Comparing supervisees is generally discouraged, and focusing only on positive or negative aspects is not helpful. Good feedback is clear, factual, and covers both the good and the bad. Question 75. A measurement procedure where you record whether a behavior occurred 8 ALL during a specified time period, example per day or per session, is called A. Frequency, B. Rate, C. Percentage of occurrence, D. Interval recording. Answer. C. Percentage of occurrence. This question describes percentage of occurrence as a measurement type. When you are interested in whether a behavior happened or not within a larger observation period or specific opportunity, rather than counting every instance or measuring duration, you might use percentage of occurrence. This involves recording the number of trials or sessions where the behavior occurred at least once, divided by the total number of opportunities, multiplied by 100. For example, did the client greet you today? Yes/no. Over a week, you can get a percentage of days they greeted you. It measures if it happened out of the chances it had to happen.